Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 233. Describe the action of the indirect cholinomimetic agonists. The way indirect agonists work is that they inhibit acetylcholinesterase, and acetylcholinesterase is the enzyme that breaks down acetylcholine in the synaptic cleft. So when that's inhibited, that would lead to an increase in the endogenous acetylcholine, and that leads to an increase in acetylcholine's activity. What is the clinical use of neostigmine? The clinical use of neostigmine is postoperative and neurogenic ileus. It's also useful in urinary retention, myasthenia gravis, and reversal of neuromuscular junction blockade postoperatively. What is the action of neostigmine? Neostigmine's action is to increase the endogenous levels of acetylcholine, but it does not have any CNS penetration. How can you remember that neostigmine does not have CNS penetration? To remember that neostigmine does not have CNS penetration, just remember neo-CNS, so no CNS penetration. What is the clinical use of pyridostigmine? The clinical use of pyridostigmine is to use in the long-term treatment of myasthenia gravis, and it also does not penetrate the CNS. What is myasthenia gravis? Myasthenia gravis is a rare autoimmune disorder in which there is antibodies that form against acetylcholine nicotinic postsynaptic receptors at the neuromuscular junction of the skeletal muscles. Describe the actions of pyridostigmine. The actions of pyridostigmine is to increase the endogenous acetylcholine, and it's stronger in the treatment of myasthenia gravis than neostigmine. What is the mnemonic to help you remember pyridostigmine? Just remember, pyridostigmine gets rid of myasthenia gravis. What is the clinical use of edrophonium? The clinical use of edrophonium is to diagnose myasthenia gravis, and the reason for this is because it's extremely short-acting, so it can only be used in the diagnosis of myasthenia gravis. What is the action of edrophonium? The action of edrophonium is to increase the endogenous acetylcholine. What is the clinical use of physostigmine? Physostigmine is used in anticholinergic toxicity, and it also crosses the blood-brain barrier to enter the CNS, and the reason for this is because it's a tertiary amine, and tertiary amine can cross the blood-brain barrier. What is the action of physostigmine? The action of physostigmine is to increase endogenous acetylcholine. What is another use of physostigmine? Another use of physostigmine is to treat atropine overdose. What is the clinical use of Donepezil? The clinical use of Donepezil is to treat Alzheimer's disease. What is the action of Donepezil? The action of Donepezil is to increase the endogenous acetylcholine. One additional note about the cholinomimetic agents is that to watch for exacerbation of COPD, asthma, and peptic ulcers when giving to susceptible patients.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.